Hey guys, Nate here. So this week I want to continue our series on back pain. So how can we improve back pain? This week we're going to talk about if you fall under the stabilization treatment classification. So that means if you hit 3 or 4 of these standards, you probably need more stabilization than you need mobility or somebody to pop your back or anything like that. So if you are under the age of 40, you have an aberrant toe touch. So what an aberrant toe touch is, means if you should come down and touch your toes, do you need to crawl back up, or do you have pain when you're going down and you kind of have to like crawl yourself down just to kind of get it? It kind of, when you touch your toes, is there like a little hitch in there, is what an aberrant toe touch would look like. Do you have a straight leg raise that is above 90 degrees? So that means if I can lay you down on the table and this other leg is still, and you can lift this leg up past 90 degrees, keeping it straight, that would mean you would have a positive finding. And then the other one would be is if I would lay you down on the table and kind of push on your back and find a painful area, and you lift your feet up off the ground, and that is a little, that pain kind of goes away, that would be a positive finding on there. So if you have 3 or 4 of those, I would classify you as a stabilization treatment classification, and we would work a lot more on stability wise on there. So if you think you are a stability case where you may just need a little extra core stability and your back pain would improve, here are a few things that you can try to see if that helps eliminate it. Okay? So first thing I'd like to do is I would get down on the ground and we're going to build stability through the ground. So what that means is a lot of times what I see when people fall into this category, they don't know how to use this front side of their core. A lot of times what they do is if they are trying to stabilize, they end up arching their back. They don't know how to keep this spine flexed and using their core instead of just using their low back. So what I like to do is put people in position that they have to use that front side of the core, so using here. So what I like to start out with is one leg's going to be straight, one arm's going to be straight above you, and your elbow and your knee are going to be together. What that forces is that low back to round a little bit, and you're using this front side of your core. So from here, we're in control rotation then, all the way down, tap your knee to the ground, and then come back up. You're going to do that again. So go all the way down and all the way back up using this, what my left side is, as control. That's going to be a really big focus on the control of this lower abdominals, lower stomach muscles, and then that's going to build the stability for your back. Okay? So that would be your first go-to. Where I would progress from there is going to be on your hands and knees and create a lot of tension. So what I mean by that, we're going to get on our hands and knees and we're going to think of 3 things. We're going to think of your grip, your stomach or your guts, and then your glutes. Okay? So you're going to go hands and knees. I want you to arch your low back down and head comes up, and then you're going to go the opposite way. So this is the position I want you to stay in. So I should feel a whole lot of stomach muscles work as I'm trying to press this low back up off the ground. From here, I want you to grip the ground and then squeeze your glutes, your butt muscles together, and hold that for a breath. If you can do that and do that with relatively ease, we're going to progress to the next step where we're going to go arch that low back, grip the ground, squeeze your glutes, and then come up, knees barely off the ground, holding that tension, and hold it for a breath and come back down. Okay? And you can repeat this. These should be pretty tough exercises because we're creating a lot of tension through the front side of the stomach, your glutes, and then through your whole system. Okay? So you should only be able to do about 6 of those. 6 to 8, okay? So from there, so now we have hips flexed here. We want to start working on getting your hips extended. So we've done it with hips bent. The next place that I'd go is one leg extended, and see if you can still arch your back in the same manner, keeping this leg extended. If you can, we're just going to do the same series here. So you're going to arch your low back, grip the ground, and squeeze your glutes together, and hold for about 5 seconds or a breath. You do that 6 times and then switch to the other side. So you're going to be here, Arch the low back up, grip the ground, squeeze your glutes together, hold for about a breath or 5 seconds, and then repeat 6 times, 6 to 8 times on both sides. Okay? So now once you get good on your, or be able to create tension on your hands and knees, what I like to do is come up to 2 knees. What I like to do is grab a kettlebell, and then if we think of how our core works and how our stability muscles work, they're being used throughout the entire day. So they are long endurance muscles. So I like to do something that's a hold to get those muscles to work properly and able to get them stronger, that they can work the entire day. For setup on this, I'm gonna go feet, knees a little wide, feet together, and grab a decent weight, one that you're gonna be able to hold for about 3 minutes. So you're gonna hold, you're gonna bring the kettlebell up, bring it in front, and then the same way how we kind of arch that low back up, I want you to bring your belt buckle to your ribs, but don't lose any height. And so you should feel your stomach work and your glutes be working in this, and then you can even grip this kettlebell. From here, we're seriously just gonna be hanging out for 3 minutes, up to 4 minutes. If you struggle and you can't get 3 minutes in, either go a lighter weight or just start off with 2 minutes, okay? So the only thing I want you to do here, big cues, bring your belt buckle to your ribs, squeeze your glutes, and then take big, deep breaths. We're gonna hang out here for 3 minutes. What you're gonna notice is a lot of times for the first minute or two, you're gonna notice a good feeling right in here. And as these muscles fatigue out, you might start to shift your weight and start to lose that hip position. And that's when you're starting to rely on the muscles, and that's where I want you to stop. If you start feeling a little bit in your back, stop right there, and that's where your next progression, the next time you do this, you're gonna try to see if you can go a little bit longer with the feeling of your front of your stomach, okay? All right, so from there, I like to get some movement into hip flexion and hip extension. So what I'm gonna have you do, and this is gonna create a lot of stability through the hips so that your back's not having to control as much. What you're gonna do is find a pad. You don't necessarily need a pad, but this is just gonna raise your knee up off the ground a little bit. Go one knee on it, hands in front, and then extend one leg back. Now remember, we worked on arching the low back up, so probably start off in that position, and then I want you to transition from here as slow as you can up to one knee, okay? And then you're gonna slowly lower back down. So this is really working on hip control to take away the stress for your back. Your hips have a lot more muscles, have a lot more stronger muscles than your low back does, so they should be working a little bit more than your back. You're gonna repeat that 6 to 8 times on each side. If you notice one side's a little harder than the other, do a few more on the hard side than the easy side, okay? So those are some good exercises to start with to create stability through the system and see if that can take away the stress from your low back and maybe create some stability through that. Guys, if you think that you're a loose person and have a lot of mobility, try some of these out, see if that helps your back, and then let me know what you think. Hopefully these will help and your back will start feeling a lot better. Okay guys, let me know what you think of these, and thanks.